Welcome, everyone. We're here at Macro Social Work Stories. Do I even have that right? we're we're doing our first real live session with David Green. And before I rattle off acronyms, I'd rather him just tell us what it is, because I know this is where everyone zones out, and it's actually really important, especially with our speaker today. Acronyms like SEIU, unless you live here locally or it's related to social work, probably means very little to others who don't have any sort of support with labor unions, but I'll let him go into that. DCFS, DCS, CPS, other places. But I know David Green because we were in cohort together at USC School of Social Work in 1998 to 2000. So we learned at the same time and went in different directions, but stayed in touch. And he's done a lot of really impressive work over the years. And I'm really delighted he's here with us today. So David Green, can you tell us about some of these acronyms and your background?
Sure. And thanks so much for inviting me. I really appreciate it. And I won't embarrass Dr. Holmes too much. I will say that she was always the smartest kid in all of our classes in our MSW program. So,
oh, please.
And it's just wonderful to watch her career and all the great things she's done. So just want to say for inviting me. I won't overwhelm you with acronyms. I am part of DCFS, which is Department of Children and Family Services in LA County, one of the largest child welfare systems in the United States. So I've been there. This June 2nd will be my 21-year anniversary at DCFS. So I've done.
Wow.
I was one of those students that couldn't afford my MSW, so I was part of a stipend program that said.
Me too. Both of us
that
did
they
that.
would help. Yes. I committed to 1 year at LA County DCFS, and so my plan was that I was going to do 1 year at DCFS and then get the heck out of there. I figured no matter how bad it was at DCFS, I could survive a year. And I was obviously mistaken. So 21 years this June 2nd. I've done a little bit of everything there. I started out then as an adoption social worker, that they needed folks that were MSWs to do home studies. So that was my first 7 years, jumped around a lot since then. So I've been a supervisor. I did 10 years of emergency response. I've done continuing services, family reunification, and I spent a year and a half, almost 2 years of my life being an administrator at headquarters with a group that worked on reducing child fatalities in LA County and kind of working with the board of supervisors and the media and other nonprofit groups to reduce child fatalities. So worked on coaching and mentoring for social workers, which is one of my labors of love. And I'm also part of SEIU, which is Service Employees International Union. So our union is SEIU 721. It's called 721 because we're actually 7 unions that merged into one. So I've been part of SEIU since the day I started county service. I've been vice president of SEIU 535. I spent the last 7 years as treasurer of SEIU Local 721. So we are now 96,000 public sector employees. So we represent in LA County, we have 55,000 members, including all the children's social workers, all the supervising children's social workers, support staff, as well as workers in the city of Los Angeles, San Bernardino Inland, Tri-Counties, Santa Barbara area. And we represent not just social workers, but clerical folks, public health nurses, probation, parks and rec, nurses, Department of Mental Health across the board. So I'm really, really proud to be able to be in both those positions. I'm also lucky enough to be an adjunct professor at California State University, Los Angeles. This fall, I'll be 7 years. So I teach classes in community organizing, policy. I'm a kind of unapologetically macro social worker, professor. And so I've done that. I've taught about 50 classes, human behavior across the board. Now I'm teaching community organizing and advanced policy analysis to second-year MSW students. And I'm also part of LACERA. There's another acronym to throw at you, which is Los Angeles County Employees Retirement Association. So it's a $65 pension, a $65 billion pension fund for all LA County employees. So I've been there about 10 years. I just stepped down as chairman. I did 4 years as chairman, and it's the hats I wear. Oh, most important thing is have a wonderful wife who works in immigration law, Sadi, who Christy knows. who just celebrated our 20-year anniversary. And I have a 15-year-old son who's a sophomore in high school, and a 9-year-old daughter, Sophia, who runs the house. She's the boss of the house. She's the future social worker. So that's me in 2 minutes or less. So I tried to minimize the acronyms, but there you go. They're inevitable in the county of LA. So
it was wonderful. And that was a much better way than just rattling off all of your qualifications, because that actually, all of those things matter. Who lasts that long? Most people don't last a quarter. That I lasted 5 years. That's all I lasted at DCFS. When I heard administrator, I remember you doing that, but I don't remember associating what it was that your official role. But that year and a half, I remember us calling it the dark side. In the year and a half, in the dark side of the administration, what was your biggest takeaway in there with DCFS?
Boy, it was really, really difficult. It was really at a low moment for social work and child welfare in Los Angeles. And there'd been quite a few really high-profile child fatalities in the media, some really, really horrific things happening. And, I was a rebel-rousing union advocate in our Pasadena Children's Services office. And the director at the time called me, asked me to come down to headquarters, and said, I'm putting together a team to reduce child fatalities, and I really would love you to be part of the team. And kind of said, well, I'm a rebel-rousing union advocate. And she said, that's exactly why I want you as part of the team. And she said, we've got to do something to try to look at the root causes of child fatalities in LA County. And so I kind of agreed to sign on for about a year and a half, or actually a year at that point, with the disclaimer, the caveat that I could still keep my union membership and that I would still be a union member during that year I was at headquarters. And it was,
wow.
That team, what we did is every single child fatality in LA County, we would respond to. We would get a notification about it, myself and 5 other team members. So we'd have to, no matter what time it was 3:00 in the morning, I was in my pajamas looking at the child fatality. And if there's links to our system or not, and what we could do, we'd have to notify the board of supervisors, law enforcement, the coroner. So I did that. And it taught me a lot about the politics of social work and the politics of what happens around the child welfare system. It taught me a lot about the kind of inner workings of government and policy. And, after a year and a half, I was done, just to be honest with you. It was a lot. It was a lot just kind of psychologically, emotionally. I started having, dreams about children in body bags and things. And it was really a hard assignment because you kind of lived and breathed these really tragic cases. But what came out of that is kind of, we did a white paper and put together a plan on how to reduce child fatalities. And even though I had stepped down from that and went back to my kind of social worker role, we were able to make systemic improvements, which I see to this day. So it was a really hard year and a half, but I'm hoping that the work that we did helped make our system better and kept kids safer.
You did. I remember when you worked on that, and I'm sorry to zero in on that as well. It was just that's an anomaly in your history. A lot of people do a year or two here or there, but not you. So I imagined it was not a place you wanted to stay, but that would be difficult no matter what. So this brings me to probably what's obvious to me, and I struggled with this since we were even in school, but why is it that we feel we need to associate ourselves with poverty level wages in order to serve others? Do we all need to have a side hustle in order to grow a family, take care of basic needs, especially in urban areas? And I know you have a lot of thoughts on that, and change is something you've worked on since I've known you. And we come up, it's really hard to make change. But when we start this whole process with this podcast, and those who are listening, especially students, we say a lot of things, but we don't give a really practical outline of how we're going to do that once we get out, or they have an immense amount of debt. So even if they can get decent wages, a good portion of those wages are taken by student loan payments that are now a mortgage payment. So how can we actually take care of ourselves, advocate for wages, wherever you want to go with that. But that's where I'm headed, is what are we doing to ourselves?
I think it's a great question. And I think it was kind of my first major struggle when I became kind of an LA County social worker. because all this great stuff you learn in your MSW program about social justice and advocacy, it just seemed like it was thrown out the window once you had a county social work job, because you're just weighed down with court reports and home visits. And I just think it's part of our social work DNA, unfortunately, is we do this great job of advocating for everybody else, but we don't do a great job of advocating for ourselves. And that kind of led me to the union, because, you know, I was a brand new social worker, newly married. And I thought, you know, I saw something on my paycheck that said SEIU. Who are these people taking money out of my paycheck? So that's how I ended up on my first union meeting. I kind of went in, you know, guns blazing. Who are you think you are to take money out of my paycheck? And it was this group of social workers advocating for this macro change on caseloads and, you know, lobbying. And I just remember coming home and telling my wife, these are my people. This is like where I belong. The light bulb went on. And we do a really horrible job. We do a really hard job for advocating for ourselves. And, you know, what I tell people all the time is, you know, social work, it's not a hobby, it's a profession. And we need to be treated like professionals, which means paid like professionals, have benefits like professionals. And it's really been, you know, my labor of love is just making sure that we're advocating for our profession, because we're just weighed down with everything else that goes on with our job. And to kind of stop and take a step back and take a deep breath and say, you know, what do we need to do to have wages that are competitive, you know? And I've been part of 3 negotiation teams, and going in there, and I go in with the mindset that I want the best and brightest social workers in all of LA County. Right. And the only way you attract that is with the best benefits, with retirement security, with a 401k and a pension, with medical and dental and mental health benefits. So that's the way I've always gone in and approached it. And a lot of it has to do with the elected officials, because when I started in LA County, there was a real push to hire additional social workers. I was pushing it. And we had elected officials that would say things like, you know, over my dead body, am I going to hire new social workers or give you a raise to my face? You know, and I felt like saying, well, there may be, you know, I didn't say it, but I felt like saying, you know, there might be dead bodies unless you take, you know, our benefits and caseload seriously. And I think we've come a long way. We have now, I'm knocking on wood, you don't see me, but now we have 5 board of supervisors who oversee our system. And they actually all understand social work, and they understand that social workers need to be treated like professionals. And we've gotten, even this last year with what's happened in the pandemic, you know, every Monday, the CEO for LA County would send out an email to all of our employees saying, we're going to have layoffs and furloughs. And then every Monday I'd get, you know, 75 or 100, 125 emails from social workers that were freaked out saying, I can't be laid off, I can't be furloughed. And the way I approached those meetings, like I approached negotiations, was if you furlough one social worker, if you lay off one social worker, children are dramatically less safe. So we got out of last year actually with no furloughs and layoffs. We had raises that were on the table last year. We're able to even salvage the raises, but it was a lot of behind the scenes negotiation, advocating for our profession and getting our workers to understand that they need to advocate for themselves, you know, that it's, you know, it's wonderful you're the stoic social worker doing those extra 20 hours and not claiming overtime, but that's the way you were burnt out. That's the way you quit. That's the way you take wages that don't represent you being a professional in our professions.
You probably don't know this off the top of your head, but and Steve, Gary, just jump in anytime too. But the number of social workers of our 900,000 social workers in the U.S., how many are actually represented by a union, and how many could be? You know, that's
a great question.
I know for a lot of, I know when we've been in DC a couple of times, there's a lot of blank faces when this comes up, and the blank faces usually mean nothing's going to happen because they don't even know how to attach it. And I know it's different from state to state and county to county. But collectively, you know, I don't think many are represented. And I know when we came out of school, it was kind of an automatic, I think I remember that conversation. Who's taking this money? You know, what is this even for? It was, you know, we signed up for cancer insurance. We signed up for all of the things, including SEIU, but we didn't really know what we were doing, which was a benefit to us, not knowing it. But, so what do we do as far as getting people represented? The overwhelming response when I can get someone to answer, and Dr. Henderson and I did this a couple of years ago, pre-pandemic, asking about how social workers get involved politically or in their community advocating. And a lot of the responses were, I don't have anything left to do that. After my job and taking care of my family, I don't have anything left in me to show up to any meeting
you
for
hear
anything.
that a lot. Yeah.
Yeah. And
yes.
we make it too difficult. They don't even know where to start. And then plus the change
exactly.
from state to state makes it really difficult for anyone to take real leadership on it the way nurses seem to be pretty good at. So anywhere you want to go with that.
And I think that, and it's a great point, and I think we have to make it easy for our social workers. So what we do in the union world is, we can't spend union dues on political causes, right? They're separate buckets. Right. So what we have is something at SEIU called COPE. There's another acronym for you, the Committee on Political Education. And what it means is that you actually don't giving a certain amount of your money out of your paycheck. Like I give $20 a month towards this Committee on Political Education. And that allows us to lobby, allows us to go on lobbying trips, Washington, D.C., Sacramento, the Board of Supervisors. But I think it's so important on moment one. It's funny we're having this conversation because later this afternoon, I'm going to talk to 38 brand new social workers in their training academy that a lot of our workers, they don't, maybe they're in their mid-20s, maybe it's their first job out of grad school or their bachelor's. They don't know what a union is. So a lot of it is, this is what a union is. This is what a contract is. This is why you should get involved in politics. And the way I present it to them is, think about it this way. For us in LA County, we elect our bosses, right? We elect our bosses. So I talk about the bad old days and having elected officials that don't understand social work. And everybody, someone raised their hand and said, what changed? I'll say, what changed is we identified and we elected and we advocated for these elected officials, and then we hold them accountable, right? And when we bring them in for endorsement town halls, we ask a lot of questions about social work and supporting social workers and not being shy about it and saying, whether you are running for governor or city council or the Board of Supervisors or assembly or Senate, we want to know you're going to support social workers. And we're, our local is 96,000 public sector employees, right? And so it's not even just the money that goes along with it. It's the boots on the ground. It's the, the phone banking and the advocating. And I've said before, I'm trying not to sound like a union thug, but we tell them, look, if you're against social workers and you don't support our values, I'm going to wake up every day and I'm going to support your opponent, because we have to elect people that share our values. And I think it happens at moment one. It's like the first week they're on the job, in their orientation, this is why you need to get involved. You know what I mean? And did they get a free t-shirt for signing up? They do. But it's, maybe that's the incentive.
I'm so glad you're doing this.
Whatever it takes. Yeah. No, and it's really making that connection to what we do as social workers, to speaking up, all that great stuff you learn in your BSW or MSW is putting it into action, and the stories that we tell in lobbying, there's such power in that, and I've seen the positive results over these last 10 or 15 years.
You've got to do that, because one of the things that you're speaking to is there's a counter narrative that goes on as well. And the counter narrative is anti-unionism and anti-collective action within the field, that self-care is the answer for self-organization, that if you have burnout, the answer is not, let's work together collectively, but what are you doing in terms of your own self-care? Now, obviously, we should do self-care, but just as an example, our leadership has a tendency to emphasize self-care rather than the collective kind of work you're speaking to. At the last APM, which is the annual public meetings that we have in the field, I did a look through. There were 19 different talks on self-care that were offered by different academic leaders across the country. There was one on problems of working conditions, and the answer to working conditions was self-care.
That tells you everything you need to know. Right there.
And then the things that are on the list of self-care, we already know the answer to what happens with self-care for all of us, or how much time we have to put into that. It's a similar answer to being involved politically. I can't go, get a massage, nor can I go to my local community meeting, because I don't have time or energy left for any of these things. And so we need more time. That's part of the self-care. Everybody needs to sleep more, have time to actually eat meals. And we're not doing that for ourselves because we're not able to, in order to perform enough to keep the job that you have. So. Gary, you're quiet. Any questions?
And we have to make time for it. Yeah.
I like the fact that you talked about your history and your involvement with bringing about change with different unions. But you placed emphasis when you began that you were a part of a stipend program in child welfare. And so child welfare, we see they are working on their workforce. When I look at other parts of social work, are you familiar with other areas of social work that provide stipends and programs for their workforce? Because I'm only aware of child welfare that really promote investing in students so that they can give time into their workforce.
And I know that through the County of Los Angeles, that in addition to child welfare, there's also, Department of Mental Health provides a stipend as well. These kind of county programs to get people to commit to 1 year or 2 year. And
I had
we've
a
had a lot of
2-year
success.
child welfare, but DMH.
Exactly. You did it the right way. I should have done it 2 years, but I did 1 year. And you were smart. And they, I think that they need to do more of that. I view it as my job is kind of keeping them, keeping them at DCFS, right? And making sure we're offering those benefits and hours, towards licensing and things, just those incentives, benefits to keep people around, because we do have people leave after 2 years.
Yes.
David, I remember the first, I want to say we were actually being paid. We weren't interns anymore. So it was the second year, but first year being paid. And I remember sitting in the corner watching someone go by crying. They were just crying and crying. And I asked someone who was training me, wow, I wonder what happened. She goes, that one's not going to make it 6 months. So I remember there being this, the 1 year or 2 year thing was actually, I think we took that very seriously because there were a lot of rumors around how hard it was to stay at DCFS. So you actually, I remember thinking I shouldn't have agreed to 2 years. That's going to be way too long. Yeah, I stayed 5, but what you did was actually, considering what we saw all the time, was probably the most prudent thing to do. So but then you stayed 20 something years now. So.
And it's the struggle. And we noticed that we were hiring this large clip of new workers and they were leaving in droves, right? At one point we had the normal attrition rate for social workers in DCFS was about 4% because people retire, they move, things happen. But for our new hires, it was almost 45%. People left after their first year, which is a huge red flag. I compared it to like having a revolving door in front of our offices. And so we did kind of a deep dive into the research and surveys of people that have been there. Why do you stay? And so what we found is that people that had that support system the first year, every office, we have 23 offices. Everybody called it something different. Coaching and mentoring, big brother, big sister. And so what we did is we kind of implemented this coaching and mentoring program for new workers. And it wasn't just about, showing someone how to do a court report or home visit. It was, I've had a really crappy day. Like, can we go to Starbucks? Can I talk about it with you? And in the first year, we kind of implemented it and made sure we trained folks and identified people to be mentors. And we made it consistent across the 23 offices. In the first year, we dropped from 45% attrition to 8% attrition in 1 year. It was like revolutionary. We actually won a productivity award from LA County because we, saved so many jobs. It was amazing. And you're working on cases together. And to this day, every single new social worker that comes into LA County DCFS is assigned a coach and mentor for the first year. And it sounds really obvious, but we weren't doing it. And it was those folks that were just kind of walking out the door. And even the people that hated social workers that I had to pitch this idea to, I said, how much money are you spending recruiting social workers? How much money are you spending training? They're walking out the door. So even if you hate social workers, you don't like losing money, right? And so since we've kind of implemented that, that's made a huge difference. And I know other counties and other states are using our model, which is fantastic because we pushed for it for 10 years and now it's finally implemented. And when you talk to social workers, they let, we vent about caseloads and things. You see the smile and the body language change when you talk about the coach and mentor. Well, I love my coach and mentor. And it's really revolutionized our department and made a big difference.
Yes.
You mentioned the money thing. And social workers really shy away from that in advocating for themselves in their community, local reps, all of that, because they don't want to sound crass, or they just talk about emotions and all of that. And one of the things I've been trying to drive home is, no, you need to, hit the wallet. If we don't do this thing, it's going to cost you more money. So you approach it as costing more, costing less, productivity up, productivity down. That's what they're going to hear. The emotional part maybe, you know, it'll be an extra bonus, but we have to focus on what they're focused on.
Absolutely.
Gary, I think I interrupted you. Sorry.
Oh, I was just reiterating the fact that when you talked about the investment in new staff, new social workers, in any profession, we know that when you invest in them for the first 2 to 3 years, the ability, them staying around is longer. And so
Yes.
we put so much money into investing in students to come upon the internship, but then when we get them, like it stopped. So we know that it's very important to continue to create supportive atmospheres. What we tell for our social workers to do for their clients, we do to our workers. So like we engage, assess, planning, but we don't engage some of the interesting environments I've been a part of. It's been with social workers, and so we need to utilize what we practice with our clients. Utilize that with each other in the workplace. And so I'm glad that you all investing, consulting with new social workers, and hopefully they can in turn do that to social workers come after them in that process.
It's a great point.
Got a little tongue tied.
No, and it's so important what you said. And I just think even the words we use is we value you. We don't want you going anywhere. We want to keep you happy. We want to make sure you feel supported. People don't take the time to do that. Our administrators, our managers, I think that new workers need to hear that. We value you. We don't want you going anywhere. We want to treat you and pay you like professionals. We want to give you benefit. This is not a hobby. It's a profession, social work. And I just think, you know, we need to use those words. People need to know that they're supported. That makes a huge difference.
We went through this really fast. I have so many more questions, so we might have to bring you back at some point.
Anytime. I'm always glad to come back. Great questions.
Oh, thank you. Thank you for coming. And
of course.
Thank you for helping social workers feel seen over all of these years.
Oh, yeah.
That's really what I feel like you've done.
I appreciate you saying that.
It doesn't cover it, but that's what you've done.
No. And thanks to all of you. I love that you're doing this. I think it's fantastic. So anything I can do to help, let me know. Be supportive.
Well, we'll see you again, I'm sure.
I hope so.
Thanks, Steve. Okay. Thanks, Gary. Any last words?
It's been great. And thanks. It's really been terrific what we've learned from you. And let's hope that social workers begin to learn the same lessons that obviously you've lived. It's been very impressive for all of us. Yes.
Well, thank you for your commitment. Thank you for, after hours, going to those meetings, collaborating, and also investing in our as a professor, adjunct professor. We need to connect with social workers who are in the field, in the classroom. There is a collaboration, they need better collaboration with using social workers who are actually on the front lines in the academy. So thank you for the work that you do.
So glad you have those new ones today, right?
Today, this afternoon, in
all
a
right.
little while. Academy 73. Great.
Wow,
Thank you all.
Great.
Take care. Thanks for your time.
Thank you.
Bye.